You are consenting to be recorded. Continue button to act space. Zoom meeting. Meeting information. Turn off original sound. Select the microphone.
Craig, you on?
I am on. Can you hear me?
Yes, I can, sir. Okay, terrific. So we're going to get started up in a couple of minutes just for everybody. We got a bunch of people who are probably trying to get in. So just know another minute or two and we'll get started up.
Very good.
All new participants 4. Jerry Barrier, me, computer audio unmuted, video on. To move to an item, press.
So I'm recording. I'm going to share my screen. And I hope I do this the right way. Can you see that?
Yep.
Okay. I'm not going to do anything else because I got people who are going to come in and I know I'm going to get the knock knock and who knows what happens at that point.
Okay. Are you going to share in a slide presentation, or are you going to do it this way?
No, I'm going to do it as a slide presentation, but I'm worried if I start the slideshow,
Right.
that if somebody tries to knock and come in, I'm not going to be able to let them in. I got to like get out of the slideshow.
Gotcha.
Not that I'm not going to try to get out of the slideshow at some point because we have other pieces that we add in, but
Everybody's in at that point, so.
yeah, we'll see what happens. Yeah, it was just, I don't know. It was getting squirrely there. So we got some more folks coming in. They're trying to join. So we're giving a couple of more, just another minute or two, because we know we got people who are coming in and trying to join. So hopefully Pam just got in. I'm just going to give it another minute just because I know we had a bunch of people who had signed up and sometimes it gets tough to try to get in. And my worry is if I start this up and then they start trying to come in, I'm going to get thrown off with the slideshows because who knows. So let's give it one more minute and then we'll start up. All right, so I'm going to start us now, and hopefully, if somebody comes in, they can catch it as we catch, and we can let them in. So we're hoping to go from there. Okay, so see, there we go. Look at that. See, right on cue. I put that up. Hopefully, Laura is getting in. Laura, did you make it in?
Hey, Tom, it's Laura. How are you?
I am doing just fine. So I was just literally getting ready to start up and you slid in under the wire there.
Oh, great. Did you see my email? Our interpreter, I guess, she didn't get the link.
Okay.
I just emailed you a couple minutes ago.
I didn't see that. But she registered.
She did. But I'm wondering, is she using the right email that she registered?
Yeah, maybe that was the situation. Maybe she used a different email.
Because it was in an iCloud account.
You want me to try to send it to her real quick?
Yeah, that'd be great.
All right, let me do that.
But I don't see that Lisa Chiango is on the call.
All right, so we're gonna take a real quick. As I try to do this.
Oh yeah, it looks like she's responding from a Gmail account, but I think she registered at an iCloud account.
Okay.
So that might be the issue.
So I just sent her a link to whatever email she sent to me.
Okay. Thank you.
What you just did right there. Lisa is coming in. So she's there, so we will give a second for the interpreter to come in for Lisa. Just gonna put that in the chat for her. So those who are just joining, we're actually now waiting for the interpreter to join. She was having a little trouble and struggling, so just, unfortunately, just give us a minute and we'll start up here. Excuse me. Laura, you want to say anything before we start up?
I think so.
Okay.
Cool.
I was hoping
Excited to have you
some of
here.
the-
Thank you.
I was hoping to break some of the silence there, but that's
You don't know a good joke?
Yeah.
As if people have questions, Tom and Craig, can they reach it? What's the best way to reach you?
Certainly. So easiest way to catch us is email. And so it's T Alessi, and I'll go through that when I introduce us at moodystreet.com, and Craig is C Richardson at moodystreet.com, but I'll touch on that when I get into it with the direct phone line is 617-682-7374. So we've got our contact sheet up and so on as far as any questions. But the other is certainly there is, and there she is. Charlotte, you made D, you make it okay?
I did. Thank you.
Yeah. And so I believe Lisa is on. And so, yes, the answer to that is we actually will supply a copy. This is being recorded. So we will actually send you out a copy. We send to Laura a copy of the recording so that you can have that. And that's a good point to everybody as we go forward with this. And we do mention that any questions, please feel free to use the chat box. All right, I'm going to start up now. I appreciate everybody in terms of going through this. I'm going to start from the beginning here. So, Craig and I call this, you think you're going to retire when, but really what we're talking about today is retirement planning, but a lot focus on Social Security and Medicare. Right, so a little agenda is the introduction, which we'll just quickly run through who we are and what we do. We're going to play a little game with you. That is the retirement game. We'll touch on Social Security, like I said. We'll touch on the ABCs of Medicare. And then we'll also segue a little bit into healthcare needs in retirement, because that's something that needs to be focused on. But there is an opportunity at the end for questions. Also, there is a chat box. I'll bring Craig on in a second to introduce himself. But as we go through this, if you have any questions, he's going to be monitoring the chat box, and he'll try to go through that and let me know as we're doing it. So who we are, real quick, there's a lot of words on the screen. I'm not going to read them all. Just know the Moody Street Group, we're a financial services firm in Newton. We dedicate a portion of the firm to supporting families who have a child with special needs. We do a lot with the special needs community. So this is Craig and I. I'm going to just quickly introduce myself. So Tom Alessi, I've been in the business for 21 years. I am an investment advisor, which means I act as a fiduciary whenever I'm doing any sit downs or giving advice or information or guidance to my client. Craig, why don't you bring yourself in for a second?
Sure. So I'm Craig Richardson. I've been Moody Street for a little over 7 years now, but in the industry for 16 plus. I'm a financial services representative, and I work with families to help them come up with a comprehensive financial plan so they can reach their financial goals.
That's terrific. Like I said, Craig will be threading in and out of the conversation, but he'll also be manning the chat box. So if you do have questions, feel free to touch base and shoot them out as we go along. As I started to say, one of the things we do with Moody Street is we try to promote and help organizations like the Perkins School as much as possible. We do a newsletter every month that's sort of a update that we blast out to our tribe of followers that gives upcoming events and trainings, conferences, fundraiser, etc. We've done a lot with career launch at Perkins through the newsletter, but we try to include everybody in this. We've also done webinars where we're trying to do outreach to the general public. One of the ones we did with Career Launch was on it's diversity and inclusion in the workplace. We had both Alicia and Dina from the Career Launch program on, where they were just going through ways employers could be better at hiring practices for inclusion and diversity purposes. All right, so now we're going to get into this. We're going to play a little game with you. Now, we take the information here very seriously, but we're trying to put a little twist on it and have a little fun with it. Okay, so understand we're taking this as very serious, but we want to play a little game, right? So this game is called the retirement game. And one of the things that starts with the retirement game, oh boy, what did I do now? I got to tell you, one of the things I meant to apologize at the start. I was running through this earlier, and I don't know what PowerPoint was doing on me. So if this gets a little squirrely like that, just understand it's technology and we're dealing with it. So we're going to play the retirement game. All right. So retirement as it used to be, right? So what everybody thinks of retirement, and Craig, you can come in with a little bit on this, right? We sit down and ask somebody, when do you want to retire? What's the first thing they say?
As soon as I can.
Yes. What's the number that they say? Work with me.
Well, I think 65 is kind of the gold standard for some reason or another.
So 65 is the number, right? 65. And just so you understand, 65 is a made up number. It is made, Social Security came up with it back in the 60s. That's the number. And really, we'll get into it when we talk about Social Security and we talk about Medicare, but it's really only Medicare that's really predicated on 65 anymore. 65 is a number, and it really doesn't mean much as far as retirement, though plan documents, retirement plans, pensions, all of that stuff still uses 65 as sort of the base. And, you know, in the past, it meant, okay, I got Social Security, I got healthcare benefits, I got a pension, I'm getting my gold watch and a lawn chair, and I'm going to chill out. That's what retirement meant, you know, 15, 20 years ago. You know, now it's different. Now it's much more complicated. There's not pensions anymore. You got kids in college, you got, you know, healthcare needs, and who knows what's going on with Social Security. So there's a lot more involved here. And that 65 number, like Craig said, maybe not so much the gold standard anymore, that people are tending to work longer. You know, some of it is out of, I enjoy what I do, but a lot of it is out of need and that I have to keep working. And that's sort of what we're going to talk about here as we go through this. All right, so retirement income. So what's gone on is that the burden of retirement income has gone from being on the employer, right, pension plans, to being on the employee in what are defined contribution plans. Not to get deep into the difference between the two plans, a pension is known as a defined benefit plan, which is just the company is going to pay you an income when you retire. That's defined benefit. Defined contribution is you're trying to save the money to do that same thing. And as you can see by the screen, the number of pension plans has been dropping dramatically. At its peak, the Fortune 100 had almost over 60 pension plans. Of the Fortune 100 companies, 60% of them had pension plans. Today, that number is in single digits. It's like 8 or 9 are left with pensions of the Fortune 100 because they just can't afford it. They can't keep that number of having to do it because it's an operating expense against the company. So they just couldn't keep doing it. So they've been closing the pension plans, you know, year after year after year, they keep shutting them down. And this should be the scariest slide of all for anyone, to understand that what a company or corporation is telling you is they can't afford to pay for your retirement, which means the burden is on all of you to do that.
So would that be 2 steps backwards on the game board?
Yeah, so that would be, you know, go this way and don't ever come back, essentially, in terms of where you're headed on the game board, right? And for most retirees, they know how much money they have. I know what's in my account. I know what all my stuff is. I've got that, you know, what that number is. They just don't know how much money or how much income they're going to be able to generate from that. And forgive me, I'm a buckets guy. I mentioned it before last presentation. All my visuals are buckets. So I've got a bucket of money. I don't know how I can generate income to last the rest of my life from that bucket of money. And that's really what we're going to talk about here in this first section as we start to play the game, right? So the visual that Craig and I like to use for everyone is that climbing a mountain, right? So retirement, if you think of this, my working years are like I'm going up the mountain, right? But what's the point of climbing a mountain? Is it to get to the top, right? What's the objective there? Is that I'm trying to get to the top of the mountain, or am I trying to get back down the other side, which in this case would be the retirement income side? Great that you have put this whole pile of money together, but unless you can navigate and safely come down the mountain and take that money out and make it last the rest of your life, that's where you run into trouble. And that's where a lot of retirees get into problem, is the trip up of how am I going to make all of this money last and how much can I safely withdraw?
That's also where most mountain climbers fail, is on the way back down.
Excuse me?
So that's also where most mountain climbers fail, is on the way back down.
Right, that's the other side of it, is that most deaths occur on the way back down, not on the way up the mountain. All right, so this slide, really, I'm not going to go too deep into this with you because we'll touch on it in a second with more, but just says, this was a 30-year period that was the best performing 30 years of the S&P 500, 1970 to 1999. You know, you look at the numbers and you can see that the average rate of return from this 30-year time period was almost 15%. It was 14.84% out over, on an average, over 30 years. Historically, you're probably never going to see those type of returns again. And what happens when we look at retirement, when we start to do this, you know, it says, gee, hey, if I had a chunk of money, in this case, this slide just says $1 million. We'll get a little bit more detailed with this in a second. And I was taking money out of it, and I'm getting 14.84% on my money. Well, you know what? Everything is coming up, you know, candies and roses, basically. You never have any worries whatsoever. You're never going to run out of money in this scenario.
Okay, won the game. I'm good.
You won the game, right? There you go. You won the game. The problem is that's where the trip up is. The game doesn't work like this. All the calculators and tools that you look at do, but the actual game does not. So let's set up a game board for you. Now, normally if we were in a room, we would pull, you know, we'd pick on somebody to give us a number. And you'd be surprised, it still takes a lot to get a number out of somebody. So in this case, I'm just gonna pick on Craig because it's easier and he's on the call with us. So I'm gonna say, Craig, you get to retirement, and I don't care what age that is, 65, 67, but let's use 65 because that's what the gold standard was, as you said.
Okay.
How much is in your account?
Let's make the math easy. Let's say $1 million.
$1 million. Okay. Now you're going to live for 20 years. Okay. That's the average. Yep. You're right on the average in terms of that. Now, of your $1 million, how much are you going to need to withdraw from that for your living expenses every year?
Well, as long as Social Security holds out, let's say 40,000.
Okay. So you're sure on that with the 40,000?
No.
Okay.
All right, let's say 50,000.
50,000.
Is that per year?
That's
Yeah,
per
per year.
So he's gonna need to withdraw 50,000
Every
a
year.
year, right? And you're gonna give him, like I did with the last screen and showed you, we're gonna give him 11.74% over 20 years. Okay, and you're gonna say, well, okay, Tom, where are you getting 11.74%? Well, this is the most recent 20 years, not that robust 30-year, you know, the greatest return of the S&P 500 ever. This is just the last 20 years up until that point, which was 2018, 1999 to 2018, right? That's the returns. You can see them on the screen. And when I average it out, the average rate of return for that 20-year time period was 11.74%. And so now what I'm going to do, and I'm going to try to get out of the screen and do this for you in live time here. This is what that game board looks like. But I'm going to see if I can pull this up. Hopefully you guys, can you still see that, Craig?
Yeah, but I think I changed my mind. I think I want 60,000.
See, now he's doing what you cannot do as far as the game is concerned, and that is change your mind, but we'll give you 60,000.
Okay.
All right. So the investment amount here, we're going to put in, he's got $1 million, he says, in his account,
Right.
right? So he's got $1 million. Here's his million, and we're going to withdraw on an annual basis. And you can see here in this S&P, those are just the returns that I just shared with you, right? Those are the returns in this growth net here that shows you, here's what those returns were every year. And now we're going to take out 60,000 a year.
Well, I figured I could because you're going to give me almost 12% as an average. So I should be fine.
Right, but what I'm not giving you that on a year-over-year basis.
Oh, okay.
So what you see here is that he ends up being okay, right? He ends up getting there and ends up at just about, he's burned through over 20 years about half his money.
What if I wanted to up that a little bit? Let's say I want to do 70,000. We'll say 75,000. I like that number. Yeah, 11%, that shouldn't be an issue.
75,000, you pretty much run out of money down here at
Right on schedule.
right on schedule. There you go. You're just about running out of money when you're ready to pass away there. So the problem is if you live longer, right? So this is the sort of, when we go through this with people and sort of talk about it, it's trying to figure out. Now, the reality is that if Craig didn't have $1 million in his account, let's say he had 500,000 in his account, and then he was back taking his original 40,000 that he had said, he's going to run out of money somewhere in about year 17 or so.
Oh, geez.
Ends up running out of money down in year 17, which means he's got to do something else. This is, I'm taking 40,000 plus my Social Security for my living expenses. And we'll talk about that.
So I can move in with my kids at that point.
You're going to live on you're going to live on somebody at that point. Yeah,
Yeah, I got a question from the audience.
absolutely.
Is it better to have more than one account?
And we did not set this person up. I will tell you, we did not put them in the crowd. That is absolutely the key. And we're going to go right into that right now. So thank you, whoever asked that question, because that is absolutely where we are headed. Because we want to talk about the rules of the game, right? So it's a game. So if it's a game, it must have rules. And so the rule is that you should be looking at how your money is used, right? So the rule is, there's only 3 things that your money does when you are in retirement. It is there to generate income. It is there to provide liquidity and or possibly leave a legacy.
Hey, before you move on, Tom, someone had a question. What were we factoring in Social Security into that last scenario?
Yes.
Okay. Well, I would say probably not, though, right? Instead of taking 40,000 out of withdrawals, that doesn't include the Social Security.
Well, sorry, and maybe to misphrase, maybe I'm misphrasing in terms of that. What we're saying is the income that's needed was 40,000 plus Social Security.
Right, plus Social Security.
Yeah,
Right.
sorry if I didn't make that clear. I thought I had said that, but that's okay. It's you're withdrawing 40,000. You already have your Social Security coming in, so that's income 40,000 plus Social Security, your total income need, right?
Thank you.
Yeah, absolutely, great question, and keep me on track with that. So again, as I come back to this, the idea here is the money in retirement, it's only can do one of 3 things. The problem and where this trips up almost every retiree entering into the game is that they try to make the same asset do all 3 things. And you cannot make one asset do all 3 things. You just think of it this way. I can't spend the dollar today and expect to have it next week, right? And that's what happens. And so to get right to the question, the person who asked about, should you have separate in my case, buckets, right? So separate buckets, absolutely. And the idea there is I'm now setting myself up so that I've got my income bucket, I've got a liquidity bucket, and then if I'm looking to leave money to a beneficiary, to an heir, to a charity, whatever it may be, the Perkins School for the Blind, I have that set up as well. So that's really the idea, and the function of this is starting to look at it and say, gee, I really need to be thinking about how my money is set up and where am I drawing that money from? Because the money I'm taking out, if it's in my retirement account, I'm getting taxed on that. And we'll talk about what happens with the taxes in a second, but that becomes a factor. So maybe I need to have some other, maybe it's money in a non-qualified in our world, that's not pre-tax retirement account, like a stock or mutual fund, or maybe in a Roth, as far as that's concerned. Roth is after-tax money. That's an IRA that is not pre-tax. You don't take it off your taxes. However, when you take the money out in retirement, it's not taxable.
So isn't this kind of a paradigm shift too, Tom? Because I know a lot of times when I hear people talk about retirement, it's always about how much money am I accumulating? It's really never about the distribution that we're talking about today. Like this,
Absolutely. That is, and we're going to, him I planted in the audience, so you know that he's planted, right? So we're going to segue right into that with this in terms of going through it. But that is the idea. Is it's again the analogy with the mountain that I'm working, I'm accumulating, I'm building up this big pile of money, whatever size that is for you. I'm filling that bucket up. Now, when I retire, I got to start taking that money out, and I got to do it in an efficient manner so that it lasts the rest of my life.
I got a quick question. I'm sorry. I
Yep.
didn't pick you up.
Sure.
If a job gives you a 401k, is it also good to get your own 403b?
Well, so the 403b arrangement, just to clarify with this, a 403b is an employer-sponsored retirement account. So you can't have your own. What you can have is your own, if you're saying that, hey, the company is making available a 403b along with a plan that they're also contributing to, possibly. You're better off probably looking at either having an IRA, or depending on your age and what you're trying to accomplish, the Roth IRA, if a Roth is not available to contribute to. Laura, you might want to just chime in quickly on this one. If there's no Roth component in the plan, I don't know.
Yeah, I was just going to chime in. So we offer 403B for employees who wish to make elections out of their own paycheck to contribute to retirement savings. We have 7 different vendors that we partner with.
Okay. Yeah.
And then we also, so those are for employees to make their own elections. Perkins has a 401A retirement plan where Perkins makes contributions to retirement savings on your behalf. So it's based on a percentage of your income. It's of no cost to employees. And I'll put the links to Ask How. If anybody has questions about either of those plans, you can reach out to our benefits manager, Robert Keegan.
Thank you. Yeah. So the 401A, that's an old money purchase plan, which is basically allowing Perkins, which is tremendous, to be able to make a contribution on behalf. So in that conversation, to answer the question, then the 403B becomes like your IRA. So the idea there is, yes, if it makes sense for you to be adding and taking on some of that additional, I want to put some money away, the conversation becomes, if Perkins has made contributions on your behalf, and maybe you've done some contributions to the 403B, again, the Roth becomes another avenue of creating that other bucket. So you can have multiple buckets, it's just depending on how and what you're trying to accomplish with them.
But the 403b though is nice from an employer standpoint because it comes out of it's payroll deducted right out of your check, which
Right.
makes it very easy to contribute and get in the habit of doing.
Best way to have it, because that way you've set it, you forget it, and it's taken care of for you. So Craig and I always recommend, if you have access, you're looking to get the contribution, there's no better way than participating in a plan through payroll deduction, because you're not going to feel it eventually. Okay, so this is just a quick, it's not about rate of return. The problem with a lot of software and a lot of stuff out there, it always talks about rate of return and, what are you getting for a return? But if I gave you 4 numbers that look like this, in year 1, you're up 100%, you feel great. Woohoo, we did really, really well. But in year 2, I went down 50%. Well, okay, I'm not feeling so good right now. I went up again in year 3, 100%. And then in year 4, I went down 50%. So just 4 years of returns there, up, down, right? When I do it out, when the software and all the calculators averages that out, they say that your average return over 4 years was 25%.
Yay.
That's not how it works, right? As we just tried to say, and this is sort of trying to drive that home, because let's look at a real world scenario. If Craig said, here's $10,000 and I want to invest in this particular scenario, what is going to happen with his $10,000, right? So his $10,000 in year one becomes 20.
Yay.
He's feeling really, really good. But he hung out in there, right? So his 20, he lost 50%. He's back down to 10.
Boo, you're fired.
You're out. That's it. Year three, he went up 100%. He's back to 20.
So you hired again.
Yeah. Year four, he went down 50%. He's back down to 10. Guess where he winds up after 4 years? Back where he started. His return is actually zero.
Kind
He
of gave
didn't
me
get
this.
25%. He got zero. So you just got to be, a little bit with some of these calculators and tools tend to give you, hey, this is what it's going to look like if you get 6 or 8%, while you're in your retirement. And it doesn't work that way. It works in accumulating because you're constantly feeding and putting into the system. But when you're in retirement, you're taking the money out and it doesn't work the same way. And this is what Craig was talking about with the withdrawal rates, not rates of return, because this is what it's all about. It's all about taking the money out and trying to make it last. And when you look at this, this says at the top, if you read from I'm looking left to right on my screen. I don't know how it reads on your screen. So
Same way.
yeah, I got to tell you, it threw me off. I was doing a trivia thing last night and I kept reading the screen backwards. So I was failing miserably. Anyway, 100%, if you look at that, it says, okay, if I'm going to make it 100%, and then the bottom across the bottom is number of years in retirement. So if I'm going out 20 years in retirement and I'm trying to take 5% on my money, the likelihood here that I'm going to fail is about 10%. I've got a success rate of approximately 90% that I'm going to be okay taking 5% out over the time period for that amount of money. So if you follow me, if I live 20 years and I take out 5%, then more than likely, like Craig said, I made it, right? If I'm okay, I got there in terms of dealing with it.
Right.
It's when we start to get out even farther, and that's what's happening nowadays. We're living longer. The average life expectancy today is about 87, right? So we start moving the number out. And if we're moving the number out, and then we start to take a little bit more, that success rate starts to drop dramatically.
So that success rate means I could very potentially run out of money even if I'm only taking 4 or 5 or 6%.
Correct. As you go out, but as you get into your 90s, yes, absolutely, more than likely is the scenario is you're not going to be able to sustain the withdrawal that you were doing, right? That's what the top line is talking about. That's at a very, very conservative, that top line, 3%, if you go back to Craig's scenario where he had $1 million in his account, 3%, that is only going to give him $30,000 a year to live on.
Well, what happened to that 4.5% rule I heard about? That if I only take out 4.5%, I should never run out of money, right?
Well, that's if you were not, so the 4% rule really doesn't work anymore. The 4% rule was put into play in 1976, right? Where expectations and what was happening at the time, a lot of it was predicated on returns and yields, specifically bank and interest accounts and those type of things. You're not getting those nowadays. And so this is just a calculation that's run. It's what's known as a Monte Carlo simulation. They punch in every type of scenario from 100% stocks to 100% cash in the bank and all sorts of scenarios that occur in terms of markets ups and downs and sideways and everything. And this is what it gives you for an output. So the reality is that you should be thinking on a more conservative level with the money that you have for what you're going to take out. And you've got to be clear and be wary on the tax implications of this. And that's what we're going to go into here. Because if we're playing a game, go ahead.
Before we get into the penalties, I had someone asking if we should put the maximum amount into our retirement plan.
So again, I didn't put this person in the audience. It's a great question and it goes right into what we're going to talk about right now. So hopefully I'll answer that as we go through this, because if we're playing a game, there should be, if there are rules, there should be penalties then, right? And so what happens with the penalty is that, the money that you put in there ultimately in a retirement account, 401k, 403b, IRA, the government wants his cut, right? Uncle Sam, he wants his share of the money. And here in Massachusetts, his little baby brother, the state of Massachusetts, also wants his share of the money. And that money's got to come out. It's got to come out in what is known as a required minimum distribution. Now, the Secure Act last year, passed at the end of 2019, changed the RMD, that's what required minimum distribution stand for, from 70.5 to 72. So unless you were 70.5 and you're on this call, your RMD is going to be age 72 going forward. Must start at 72 years of age. That means even if you're just chilling and not having to deal with anything, you're living a good life and not having to tap into your money, the government wants you to start tapping into your money, is what's going to happen. Right? And if you've got it in IRAs, they can be pooled together so you can draw from one and not have to touch others. But if you have money in a retirement account, i.e. 401k, 403b, an employer-sponsored plan, that has to be dealt with separately. So eventually what happens is that the government says at the end of the year, 12/31, we're going to add up all of your qualified money, that's pre-tax, that's IRA, 401k, 403b, and we're going to say, you owe us X on that. You have to take this amount of money out at age 72 if you haven't done it yet or haven't taken any money.
What if I don't?
We'll get to that. That's what we're getting to, right? So it's based on mortality. And so just to give you an example, if you're 72 this year and you have $100,000 in your account, they calculate the distribution out and it's a division and ends up being about 3.9% that you have to take out in the first year. You can see that number, it's $3,900. That would be your first required minimum distribution if you were 72 this year with 100,000. It goes up every year. They keep the calculation moving every year because they want you to be taking this money out. And as Craig asked, what happens if I don't take my RMD? The government says it's a 50% tax penalty on the money you did not withdraw. So in this case, that would be over $1,950 you would owe as a penalty for not having taken your RMD.
Yikes.
Now, I will tell you, so it's not like the government's zoning in on, little old ladies who haven't taken their RMDs yet. But we just passed a $1.9 trillion stimulus package, and that money's got to be paid back somehow, some way. And taxes are the number one way that's going to happen. So what you're going to probably see as we go forward here, and it's just a little, forward-thinking thought, that some of these will be, they'll be stricter and tighter on looking at and trying to get as many people to trip up and to get that tax benefit as much as possible. Okay. All right. So now we're going to go into Social Security, right? And Social Security and talk a little bit about what happens. And we'll come back to the whole tax consequence thing in Social Security because it is meaningful and it is a process. But Social Security, the basics for it are essentially that, you're contributing half the money, 6.2%. Your employer is contributing the other half, it's 12.4. You see it as FICA. It's very funny. My daughter started working and they're like, what is this FICA thing? And why am I paying FICA? So anyway, it's part of that. Medicare is the other cost on FICA, which makes up the other 3.1% or 3.2% that comes out in terms of that. But you're paying part on your Social Security. The wage base for last year was 142,000 that Social Security is done. And there's two ways that you can qualify. You work for 10 years. All you need is 40 quarters, 10 years of income, and you qualify for Social Security, right? Or your spouse could have worked for 10 years and you would be eligible to collect. You earn basically 4 credits for every year. So that's why 10 years, 40 credits. And in 2021, each credit is assigned a $1,470 benefit to you. That's just the basics of what Social Security ultimately means when you go through it. But the question for everybody is, when should I collect? Well, Social Security throws a lot of acronyms at us. So FRA is full retirement age. So if you were born, there's the year. So if you were born prior to 1943, your FRA is 65. Remember that first screen, and Craig said that gold standard 65? That's because that's where all of this came from. It was all done. And so really anybody born 1942 or earlier, their FRA is 65. Everybody else, it now has started to ratchet up. So as you can see, from 1943 to essentially 1959, it's 66 and some compilation of a number of months for the year you were born. Anybody born after 1960, it's now 67 is your FRA, right? Full retirement age. What does that mean? It means you will collect what they call full benefits, or what in there is on the screen is PIA. That's your primary insurance amount. So when Social Security sends you something or tells you, hey, this is what you're going to get at FRA, or this is what you're going to get at age 66 or 65 or 67, whatever year you were born, that number they're giving you is the PIA. Now, they don't always refer to it as PIA, but that's what it is for them. And it's determined by your highest 35-year average. It really doesn't do you any good if you're 62 to all of a sudden be making 200 grand a year for the last 3 years, because it's an average out over 35. So being a high earner for a long period of time will help you. But, you know, becoming the president of the United States for the last 3 years of your earning careers isn't going to do anything for you. It's just
No catch-up provision on the Social Security.
no catch-up provision allowed in Social Security the way they do it. And here's the whole thing. So one of the things with that, and we'll go through numbers in a second with you with Social Security, but I understand they send stuff out. I know they still mail stuff when you hit certain ages, like 60, 62, and so on. All of those are estimations. It's not an exact science. Social Security will tell you that. Until you actually go to collect and they go through the whole calculation and formula, then they'll give you what your actual number is. Essentially, when they send you, or even if you go online and look it up, it's a best guess scenario by them, because they don't know until you actually file.
Well, because there's a lot of factors that go into that, right? Cost of living increases, exactly when you're going to take the benefit, all
How
those.
much you earned over so many years and the age you're at when you do it, because that's the factor, and that's what'll come up here, right? So the power of patience, this is the question everybody always asks, right? When can I collect Social Security? Well, Social Security, you can collect as early as age 62, right? If your FRA is 66, you are going to actually pay a penalty for collecting early. Just do it out. If you look at it, it's roughly just over 6% a year of a decrease on your benefit amount. So when we look at this, if somebody was going to earn at age 66, that's their FRA, and have a primary insurance amount of $1,600, if they collected a year early, 65, they would only get $1,493. All the way down to age 62, it's $1,200. That's 25% decrease from their primary insurance amount. Every year that you go past, and actually every month that you go past your FRA, your benefit increases. It increases by, it's roughly around 70, 0.70, not quite 3/4 of a percentage point every month. So that if you wait, it'll go up by about 8% a year. And so what happens is, if you're somebody whose FRA was at 66, the maximum dollar amount you can collect in Social Security actually pays out at age 70. You would have an increase of 32% over what your primary insurance amount was at your FRA. Excuse me.
So does that mean this is where the crystal ball comes into play?
yeah, how do you do this? How do you figure it out, right? Well, we'll talk about that when we get into a little bit more with some penalties. But one of the things is, yes, as Craig had just mentioned, one of the considerations becomes longevity and health. So if you're somebody who's, still fairly healthy and, you're long bloodlines and good genes in the family, well, you probably want to delay and hold off because you're going to want that money later on in life. But if you're somebody who's has issues or has some sort of, morbidity and not long life in the family, then you might consider collecting on an earlier basis. It really comes down to what you're trying to do, but realize and understand that making this election with Social Security is irrevocable. They don't let you go back and start over. They don't let you say, oops, let me try again, like Craig did, where he tried to go back to the board and said, let me take another amount out. That doesn't work. You make this election with Social Security, you are stuck with it. They will not let you change it.
I do have a good question from the audience, though. When you retire, can you still collect full benefits if you work?
So again, we didn't set this person up. This is a tremendous question. The answer to that is, if you are you can collect at any time and work. And we'll talk about it in a second. I'll go through the formula with you. But so understand that the answer is yes, you can work and collect Social Security at the same time. So to lead into that, we're playing a game. There are rules. Shouldn't there be penalties then if this happens? And so the answer is yes, if I happen to do this, right? So I'm still working and I'm under my FRA. So my FRA, let's just say for argument's sake, is 66, and I'm 64 years old. I can only earn $18,960 this year. That's $18,960. If I earn more than that, right? For every $2 I earn over that amount, $1 of my Social Security benefit is going to be taken away. Now I'm also collecting, 15, there's about 12 and a half, almost 13% less than what I would have gotten at my full retirement age. And I'm having money taken away because I'm probably making more than $18,000 a year. So really, what's the point? The other side of that is so when we get to the year of it gets funky for you, but I'm 66, and let's say you're 66 and your birthday is in June. Well, if you collect beginning in January, you can collect the full amount so long as you don't earn more than $50,000 between January and June. They won't penalize your money at all. If you do happen to say, I'm a December baby, so it doesn't work for me because I have the whole year, so I'm probably going to go over it anyway. So what's the point of that? But once you make FRA, once you get to full retirement age, in this case, age 66, you can work and collect, and there is no penalty from Social Security on that. So it means you can collect your full benefit amount. There is a penalty. We will talk about that in a second. So don't think the government's going to let you get away with this. But what happens is, if you get to 66, you're full retirement, you're still working, you say, I want to collect my Social Security, they'll give you your Social Security and you can still work and they won't take anything away from your benefit.
So what they're really trying to do is discourage people from taking a Social Security benefit too early, especially if they don't need it because they still have the same earning potential.
Correct.
Right.
That is the idea behind it. Now let's walk into what really happens with this, because there is a way that they get you with that. Your Social Security benefits can become taxable. And your Social Security benefits, when they are paid out, your tax base, the taxable amount is either 0, 50% of your benefit, or 85% of your benefit. And the grid looks like this, right? So if you're single and you make less than $25,000 of taxable income, there is no penalty, there's no cost, there's no penalty, there's nothing on reportable for Social Security. However, if you make between 25,000 and 34,000, again, of taxable income, well, then 50% of your benefit is going to be taxable. And if you make over 34,000, 85% of your benefit is taxable. So let's go to the scenario we just talked about, where somebody was getting at 66, they decide to collect, they're still working. Well, if they're working and they've got more taxable income than $34,000, they're going to pay taxes on 85% of that benefit. So it really becomes, does that make sense?
Well, here's the other question. This probably fits right into a question I got earlier, Tom, is what income is considered taxable for Social Security benefits? Because one of the questions was, what about bonds if you have some from when you were young?
Okay. So anything that is considered that you would pay income tax on is considered taxable income. So earnings from working, so distributions from your retirement account. And so this is to the question, I know it came up earlier and I segued all the way down to get here. But so here's part of putting all your money into your retirement account. That means that's money you're going to be taking out. That's taxable because you haven't paid taxes on it yet. Remember, the government wants their tax money. Well, that becomes taxable income to you. So if you're using that amount, like in Craig's scenario, he needed $40,000 originally that he wanted to live on. Well, that $40,000 is not all taxable. That's more than what the Social Security limit is. He's going to pay 85%. He's going to get taxed on 85% of his Social Security benefit along with that.
All right. Now, municipal bonds, though, while they may not tax me per se, are still going to be counted against me for Social Security, correct?
No. So municipal bonds, Roth distributions, money that's sitting in life insurance, that type of thing, not taxable, right? Not taxable income to you. We'll talk about the municipal bond trip up when we get to Medicare. That's a different animal.
Oh, that's where
That's where that comes in, and that's even worse in terms of this whole scenario as far as what they do there. But so for Social Security purposes, because that's what we're really talking about, you just understand that. That's why we mentioned earlier about that whole thing about diversifying and spreading the buckets out. Because if all of the money is sitting in a retirement account, it's all pre-tax, well then it's going to come out. It might trip off my Social Security, which means if I was counting on that to live on, I've got to make that money up somehow. Where am I going to get it from? Oh wait, I got to dip into my retirement account and pull more money out. And guess what? I'm paying more taxes on it. And we may then trip ourselves into a higher tax bracket because of that. So there's a lot that's got to be considered when you go through this. And, I know, like I said, we play the game with it and we try to have a little fun with you. But the idea is it's really got to be thinking about how am I taking this money out and how am I being really efficient with it? And does it make sense for me to look at maybe diversifying some of this into different buckets so that I have different places I can pull from as I'm putting together my income stream when I'm in retirement.
Well, this is the other problem too with the retirement game, Tom, is that the rules keep changing. So in other words, just because my tax bracket today in retirement would be X, doesn't mean 15 years ago, from now when I do retire, the tax rates are going to be the same.
Yeah, I can only give you the sandbox we're playing in right now. That's the only thing we can do. This is what the rules are today. Who knows where we're going to be? Like I said, that was it's a T after that 1.9 trillion. That's a big number that the tax rates have to go someplace with this. So, but we can't, that's speculation, and what all we can deal with now is what we have currently for the scenario, and this is where we are right now with everything.
That's why you want to use multiple buckets with multiple tax consequences. So because you don't know how the game's going to get played later on, right?
Exactly. That is exactly the case. Okay, so stop me if you've heard this one before. Social Security is going broke, or I'll pay less in retirement. And so Craig sort of walked right in with that one, right? So Social Security is not going broke. What's going broke is the slush fund, right? So you had for years and years and years, more people paying in than more were taking out. What's happened now is all of those people who were paying in are now taking out, and you have a generation that was less as far as workforce was concerned. So what I describe as the silver tsunami, right? That 10,000 people a day are turning 65 and starting to access Social Security. That's what's happening. So the reserve that's been built up is being deplenished and is probably going to run out of funds somewhere, I think, around 2035. But understand this is a pay it forward system. So there's always going to be a generation that's putting in to the bucket. Now, will they be making changes? Will they be upping the amount that's being paid into it? Will they be delaying like they did? Like you saw, we went FRA from what was 65 to 66, now 67. To my kids end up being at 68 or 69 for their FRA. Does early retirement no longer mean 62 and they move that to 63 or 64? These are all tweaks that will come with the system to make sure that it stays buoyant at least. But just know somebody's always paying in. So there will be funds there. You're just not going to have the slush fund that was available. And Craig just talked about, less taxes when you retire. Who knows? Right now we're at a very, very tax-friendly environment, which is all we can talk about really. But, where we're headed with this stimulus package and other things that are coming are probably where we were back in the 80s, where your top tax rate was in the 70% range. Right now, the top tax rate's 37. It's like half of it.
But even if it wasn't, Tom, the big misconception I get when I do planning for people is they think they're going to spend less money when they retire. And I guess that's true if you're not going to do anything. You're kind of taking the longest vacation of your life. What do people do on vacation? They spend more money.
Right. Yeah, it's absolutely a consideration. You got to be thinking about that in terms of what you're doing. The other thing that people talk about when you get to retirement, and some of you on the call maybe have already started this or looked at it, right? What's the thing everybody talks about? See, I'm a buckets guy, so I know it's a bucket list, right? Everybody talks about I want to do this, I want to do that, these things I want to get to, or I want to see, or I want to visit, or do this stuff. As Craig said, that all takes money. So it's not like, hey, granted the pandemic put us into, quarantine basically and shut us down. But, a couple of years from now when things are back to where they were and how we are, it's going to be spending, and that's the consideration to be thinking about.
Well, also, doesn't longevity come with the benefit of higher medical expenses?
Yeah, we'll get into that. Right now, what we're going to talk about is Medicare, right? So I want to shift this to Medicare, right? So it's a pop quiz, real quick, just to give you the sort of the ABCs of Medicare. So what does Medicare Part A help cover? And I'm going to put, because I don't want to call on anybody. If we were in a room, I'd call on you, but we're not. So I'm going to call on Craig. Craig, what does Part A cover?
I would say it covers your hospital costs.
And survey says you are correct. So Part A of Medicare is free. So at age 65, you can file for Part A if you want to. You don't have to, but if you're still working, it's a suggestion that you file and take Part A because A is free. It doesn't cost you any money, and it only covers hospitalization. Now, you still have to pay. There is a deductible that goes along with Part A, right, for that hospital stay, but that's all it covers is hospitalization. All right. So what services are not covered by Medicaid? Craig?
I'm going to say all the above.
You'd think he'd been through this quiz before. All of the above. So Medicare, so a lot of times what comes up, and we'll talk a little bit about healthcare assisted need, that thing in retirement, but Medicare does not cover long-term care, assisted care needs. What's built into Medicare is 100 days. You get coverage assisted care for 100 days and then it ends. Dental, hearing, vision, that's all add-on. Medicare won't cover that. Supplemental plan, that's something else entirely. We'll talk about that in a second. But pretty much what Medicare is going to cover is really your doctor's visits, your labs, x-rays, and medical stuff. That's really what Medicare is there for. When is the period each year when people who have Medicare can change their Medicare health plan and prescription drug plans? Craig?
Let's see, open enrollment anytime doesn't sound right. And I'm sure you must be able to change your plan at least once, unlike Social Security. So I'm going to say October 15th to December 7th.
Yes, you are correct, sir. So every year, once you elect Medicare, you will get notified that you can every year change your plan. Now, word of caution here for those who might be nearing or getting close to Medicare. Some plans, they change them. The providers will change the plans themselves. That does happen. And suddenly you'll find yourself being told, the Harvard Pilgrim X plan that you were on is no longer available. You've got to switch to another plan. Here's the choices that are available. It does happen. Sometimes you may make the decision yourself to say, well, gee, I didn't like the Harvard Pilgrim X plan. I'm going to go over here and try the Tufts plan or this other thing, and try to do that. The only word of caution with this is sometimes that Harvard Pilgrim X plan won't let you back in. And this is when we're going, the difference between, and we'll talk about it when we get to the slide, gap plans versus supplemental plans. That a gap plan pretty much covers everything. And a supplemental plan is more like your current health plan that you have. If you try to jump from the gap plan to supplemental, sometimes they won't let you come back. And so it's always that, just realize that sometimes it may sound better over there or may look better, but those plans, and for some of them, they'll grandfather you, right? They'll let you stay. They won't let anybody else new come in. But if you had the plan, you get to stay on the plan as long as you still want it and are still alive. So it's just one of those things with Medicare that a lot of times we recommend to people finding a healthcare professional who specializes in Medicare plans to sit down with, but also to really be seriously looking at making a decision about switching a healthcare plan once you choose it. Because it can be, for anybody who's ever had to go through it with their parents or grandparents, like, Medicare is not the easiest thing to try to get through. And then realizing that, we made a mistake, we want to go back. You can't do it until the next open enrollment period. And then once that comes up, you may not be able to get back into that plan. So just a caution on that.
So if I'm choosing a cheaper plan right now because I'm not on a lot of medication, I may save a few dollars now, but it may cost me a lot more later down the road if I end up needing to use different prescriptions.
Correct. Yep. Yeah. All right. So Medicare Advantage plans let you go to, and I can't read that, a doctor or hospital accepts Medicare. I can't read the question.
I'm going to say
any doctor or hospital accepts Medicare. True or false?
True.
False.
Ah.
Nope. Got to be in network, right? It's not just Medicare. It's a network provider that you have for Medicare. So just like I said, that Harvard Pilgrim X plan, you may have a professional that does not take the Harvard Pilgrim plan. Just understand that every plan is like a provider, same idea. There's an in-network and out-of-network, and unfortunately with Medicare, there is no such thing as out-of-network. That's it, you're covering it. All right, so the Medicare alphabet, and this is what I was talking about before. So Part A is hospitalization. You're qualified once you reach age 65. Pretty much there's not much you have to do to get enrolled with A. It's free. If you've got a plan, sometimes your provider, your current company will tell you, hey, you need to get Medicare because they're going to step in front of us on hospital coverage. Everything else will cover, but just so you know that while you're still working with this.
Someone asking if we'll be sending a recap via email because they have to leave.
Yeah, like I said, we'll send the recording out through Laura.
Great, thank you.
So Part B, right? So Part B, that this is when you no longer have access. So in this case, the Perkins school coverage, right? So you no longer have access. You've now separated from service. Once you separate from service, the clock starts ticking. You need to make the election for Part B. Hopefully you've already taken A if you're past age 65, but you need to elect B. You don't have to take B while you're still working because you're getting covered under your employer's plan. But once you separate, then you need to elect Part B. And Part B covers the doctors, their labs, that type of thing, for a portion of it. The other side with B is the premiums will be automatically taken out of your Social Security, your monthly payment. I know it was $144 a month last year. I'm not sure what they went up to. I think it might have been $146 this year, but again, I apologize if I don't have it exact.
You're saying
Huh?
there's premiums or surcharges? What are those about?
So again, the premium is what it costs you for Medicare. Like I said, standard Part B last year was $144 a month. So that's coming out of your Social Security check. The surcharge, this is what Craig was talking about before. So remember the penalties that we talked about? We'll get into that in a second. Actually, Craig, I'll wait for the screen because it's much easier to explain that way.
Okay.
So just know there are surcharges that can get added on that also come out of your Social Security.
Is there also a charge if you don't file for Part B right away?
Yes, thank you. That is a good question. Absolutely. If you become eligible, essentially you've got 6 months. You can file as early as 3 months before your date and 3 months after. So you've got 6 month window to file for Medicare. But just know that if you don't, and then you go file, what they'll do is they'll add on. That's where another one of those surcharges comes in. They add that on as an additional cost because you didn't file when you should have.
And that's a permanent surcharge, correct?
Correct.
Yeah.
Part D is prescription drugs, right? So this is how the government's alphabet work. They go A, B, D. So that's just so you understand. This is the government at work with this. But so prescription drug plans, you need to be able to cover prescription drugs, whether you get a separate plan, Part D, or you have it through an Advantage plan. And we'll talk about those because that's what falls under C, even though it really is not C, is the rest of the plan. But so you have B and D that you are paying for that you're coming out of your Social Security payment. And then you have supplemental plans. So supplemental plans break down in 2 different forms. You have gap plans and Advantage plans. A gap plan pretty much says whatever Medicare doesn't cover, we're going to pick up the tab. Whether that's the deductible on Part A, whether that's the co-pays, whether that's the having to pay for additional services when you go to get a blood test or something like that, we will pick that up. However, a gap plan no longer has Part D coverage. Gap plans do not have prescription drugs. So if you take B and a gap plan, you have to buy Part D. Again, just like Craig said, there's a surcharge if you don't do it and have D. So B plus D plus gap. An Advantage plan works more like your current health care. So there is co-pays, there's prescription drugs, co-pays on your prescription drugs. All of those things are built in just like your current plan, but you don't need to pick up D because you get it as part of the Advantage plan. Now, a lot of times an Advantage plan is much less expensive than a gap plan because there are co-pays, there's co-insurance, there's other features just like there is with your current health insurance. And really that becomes the conversation, much like Craig was saying, is does it make sense for me in my younger years and earlier if I'm healthy and I don't need a lot to take an Advantage plan versus a gap plan as far as what I'm worrying about? Or do I just say, you know what, I'm going to take the gap plan because then I've got everything covered and I don't have to think about it. That's the trade-off. That's what you're doing when you get to Medicare.
Yeah, I know you covered this a little bit earlier, Tom, but I just want to try to clarify a little bit more for somebody. Is it better to keep your own insurance or get a supplemental plan, especially if you have significant health issues?
So when you separate from service, if I'm following this conversation or this question correctly, and we can certainly have the person re-ask or follow up with us offline, and as Laura had mentioned, you can certainly reach out to us afterwards with a question. But essentially, once you separate from service, you lose your health care. I mean, you're going to elect Cobra, but there's no reason at that point, because Cobra will tell you you're Medicare eligible, you're going to take Medicare, and Medicare steps in front of any provider in that situation. So ultimately, what you wind up is needing to pull and look at getting that gap plan or that advantage plan to go along. And more than likely, if there are concerns and health issues and things like that, you're probably going to want to look at a gap plan. Like I said, it's going to cover just about everything that Medicare doesn't cover.
And can any of these supplemental plans cut out pre-existing conditions?
No, don't have that ability anymore. All right, so Medicare Advantage, again, that Part C, that I went through it. They give you a network to work within. That's sort of what Craig was asking about, and we did with the question there, right? So that becomes Part C, the Medicare Advantage plans. But you can elect this Advantage plan. There are certain ones in there, and I'm going to just go back the screen just to clarify, because when we do the supplemental, that's meant more as a gap plan, right? Part C, the Advantage plan, you can pick that up. That acts more like your healthcare coverage, just so I'm clarifying in terms of what's there. And if you do them, most of them will allow you to pay that through your Social Security benefit. So you can link it all together. Because you only have B and C in that situation. A gap plan, you do not have that. So just to be clear. All right, so the annual medical costs, right? So Part A, again, is 0. Part B, that's that $144 a month when times 12. Part D, that depends on the coverage that you're electing for your Part D. Your prescription meds can go anywhere from very little dollars, $30 a month, all the way up to, if you're trying to cover, high cost prescriptions, to almost $1,000 on a yearly basis. Supplemental insurance, that's what the cost would probably run you. Then if you add dental, plus those out-of-pocket additional costs, i.e. co-pays and additional coverage and prescriptions and that type of thing, you wind up needing to pay somewhere around $5,500 at a minimum for Medicare costs in a single year.
Yeesh.
It's a lot. Right? And now this gets to the point that Craig was trying to bring up before, which is we're still playing a game. So, there must be additional penalties. So the unpleasant surprise is that what can happen here is when your taxable income gets over a certain threshold, Medicare steps in and says, well, we're going to charge you more money for that. Okay. And so what you wind up with, and I think I'm at this is what used to be. And yeah, so here we are. This is the now, where we are now, or where what the most recent implementation with Medicare has got us to. So what that says is, if you have more than $85,000 of what is deemed taxable income by Medicare, they will increase your Medicare premium monthly by 23%. And you may say, well, that's $85,000. I'm not really going to have $85,000. Well, here's how that game works, right? So we talked to you about taxable income. Taxable income is the money I'm withdrawing out of my retirement account. Say I've stopped working. I'm just using my money in my retirement account to live on. And let's say that number was what Craig gave us originally the first time he was playing the game, which was $50,000. Well, I've got $50,000 of taxable income. All right, I'm still under the 85,000. I'm okay. But remember, 50,000 of taxable income means that 85% of my Social Security benefit is now taxable. And let's say that number was 2,000 a month. Well, that's 24,000. Of that, 85% of it is going to be taxable. That's like 20, let's put 20, huh?
20,400.
I was gonna say, just about 20,000. So then, I'm gonna get taxed on that 20,000 of income. Well, guess what happens there? That gets added to my taxable income base. So it's down at 70,000. I'm still under the 85,000, so I'm okay. But as Craig said, I've got other buckets. And one of them happens to be municipal bond, because I was told that municipal bonds are tax-free distributions to me, which is true. In retirement, that is tax-free income. However, Medicare looks at that income and calls it taxable. So if you've got distributions out of municipal bonds in retirement, it's going to get added to this number. And if it goes over 85,000, all of that adding up, dividends, income, and everything else, it's going to trigger the surcharge. So that's that whole, you got to be watching what that strategy is, because once that surcharge kicks in, it's very, very difficult to get Medicare to move off of it. So just realize that some of these strategies, may be solving, hey, I've got the money coming out, but now I got an additional 23% that I got to cover out of my Social Security that just disappeared. What am I going to do with it now? So that's one of the things you got to worry about with Medicare and getting the surcharge.
Well, if there's going to be changes in future taxes, this would probably be one of the bigger areas too, right?
Correct. Right. That's the whole thing. They haven't adjusted for the income. They've just adjusted for how much they're going to hit you for.
Right.
All right. So it's called modified adjusted gross income. That's what triggers this, just so you can see it there. So anything that's on the left-hand side, Social Security, salary, pension, required minimum distributions, dividends, capital gains, IRA distributions, and money from municipal bonds affects your MAGI, the modified adjusted gross income for Medicare purposes. What does not is life insurance, money coming out of a life insurance, money coming out of non-qualified annuities, depending on how it's taken out. Your health savings accounts, HSA is tremendous in terms of being tax-free withdrawal. Roth, we talked about Roth, and then reverse mortgages if you happen to get to a reverse mortgage. All right, impact that impact of going down the mountain, right? Having enough money to sustain your retirement. A low interest rate environment, that's where we are right now, right? You can just talk to anybody about money in the bank. It is not earning anything. Policy changes, we just talked about that. Like, stuff is going to alter or change or be different 5 years from now versus where we are today. Healthcare costs, everybody knows the cost of healthcare is just going up. And then we get to the bugaboo that trips everybody up once you get to that point, is long-term care or the need for assisted or skilled care in retirement. This is just what's happening right now in terms of where we'll be as far as the number of the population that, as I said, the silver tsunami, people getting over the age of 65, it's 10,000 a day are turning 65. Over half the population by 2030 is going to be over the age of 65. It's a huge number, right? And the demand and need for care is ongoing with that. So, again, what Medicare covers is basically 100 days. After 100 days, Medicare stops paying. There's really no other care that comes from Medicare in terms of paying for long-term care. And here is not to be doom and gloom with you here. It's a bright sunny day, so I don't want to be doom and gloom on you, but the likelihood of somebody who is 65 needing assisted care is 70%. 70% of the population over the age of 65 is going to need some form of assisted care. Something that you have to be aware of and be thinking about when you're looking at your planning. You saw the stool earlier where I told you about what it does, right, and the rules, right? It generates income, it provides liquidity, and it leaves a legacy. That's the three prongs, the three things that your money does in retirement. Craig and I always tell people you really need to have a fourth leg, but if we did a fourth leg, that would make it a chair. So it really wouldn't be a stool anymore, but you've got to add this fourth leg to it. You've got to be thinking about separate buckets. And if I've got a separate bucket For income and liquidity, I'm gonna need a separate bucket for assisted care or healthcare and retirement. This is a major consideration and something that trips up every retirement plan as it goes along. You need to be considering it and thinking about it. You know, so Medicare doesn't cover custodial care. By that, I.e. assisted living. The only place Medicare will provide coverage is in a skilled nursing facility, right? So you gotta understand that Medicare doesn't cover it, Medicaid does. But Medicaid will only cover that care in a skilled nursing facility. And at that point, you've pretty much got to have used all your money or spent everything in terms of dealing with it, right? All right, keep your plan on track. This is just trying to make sure that you stay on track with your savings. Understand your money, you need to be divvying that out and figuring out where you're trying to get to with it. You know, failing to plan is planning to fail. So set a financial goal, make sure you're paying yourself and filling the buckets that you need to fill out, considering where we are for taxes and now, and as Craig mentioned, in the future, what can happen. But understand that the difference between retirement income accumulation is different than retirement distribution and how that works. The last one.
That game was so,
Good.
I'll say that game of retirement is so simple though. Anybody should be able to figure it out all by themselves, right?
Yeah, I mean, that's part of it. And you know, it sounds easy, like I said, you know, in the beginning with the 3 legs and you know, I'm going to generate income. I'm going to have liquidity and I'm going to leave a legacy. Sure, it sounds simple, but then when the practicality of doing it and using especially one asset like a retirement plan to do it becomes very, very difficult to maintain and juggle it and make sure. And every decision is a retirement decision. Hopefully, I doubt this is going to work, so I'm going to back us out of this. We like to have fun with you, so I'm going to leave you with one that's fun. This is something to entertain you. It's a real short video, so hopefully you'll be able to hear it and see it. But what it is the marshmallow test. If you've never heard of the marshmallow test, essentially what they did was they took a group of kids anywhere from like 5 to 9 years old and put them in a room and told them, they sat them down at a table and put a marshmallow in front of them and told them, if you can wait, the instructor leaves the room until I come back, I'll give you 2 marshmallows that you can have. And the idea there was about delayed gratification and can I not do something today or at this moment so I can benefit from it later. That's how Craig and I use this, but it's also because it's very fun. So I'm going to play it for you and hopefully you can see it. Craig, let me know.
Yep, working.
Sit in that chair. All right, here's the deal. Marshmallow for you. You can either wait, and I'll give you another one if you wait, or you can eat it now. When I come back, I'll give you another one, so then you'll have to. But stay in here and stay in the chair till I come back, okay? All right. I'm gonna go do something and then I'll come back. Wow, yummy. It smells really good. All right, so it's up to you. You can have it now or you can wait. Okay? I'll be back. Stay in the chair, okay? Okay. So I'm gonna leave and then I'll come back, okay? So you can either eat it right now or you can wait. Either way, okay? Okay. How'd you do? Did you do good? You did? You wanted to eat it, didn't you? Yeah. So did I tell you to give you another one? Okay, now you can have both. You need them.
So that was a marshmallow test. And really the idea is trying to delay the gratification, don't spend the dollar today so we have it later on. And that's, we talk about, the last presentation we did for you, we talked about, making sure that you're paying yourself, making sure that you're putting money into the different buckets that you need, whether that's for emergency reserves, for midterm, some sort of buying something, and then long-term, which is retirement, which is ultimately what this is all about. All right, oh, it actually started. How about that? Didn't expect that to happen. This is Craig and I in our more serious attire when we're out and about. If you've ever seen us at any of the conferences or some of the stuff that goes on out there, we tend to have a little fun with what we do. Those are custom Patriots jerseys. They say Moody Street on the back. We have talked about having to change number 12, unfortunately, but for the time being, we'll keep the number 12 in our jerseys intact. But that's our contact information. As I said to you before, if you have any questions, feel free, and I'll touch on that in a second. But TLSE@moodystreet.com. For Craig, it's crichardson@moodystreet.com and our information. One of the things we offer everybody is there's no cost, there's no obligation, but our mission really is trying to help everybody get a better handle, better sense on how all this works. So we offer to anyone who's gone through this, reach out. We're happy to sit down with you. We're happy to answer questions, talk it through, figure out what works for you, what makes sense, and see if there's something we can do to help you or give you a little guidance in terms of that. Like I said, there's no cost, there's no obligation for that. It's something that we do as just part of a way of saying thank you for sitting through and listening to us. We are going to send you out an evaluation form. We do request that you take, it's an online, it's a link, just to open it up and send it back to us. We rarely do value the input we get from everybody that, hey, this, it worked, or I didn't like this, or, could you add that? Or if you have other subjects that you're thinking of or that might make sense for you, or something that you got a question on, just fill it out, send it back to us. We don't do anything with it. I will tell you, as part of that, up at the top, there is a question that says, hey, I'd like to be contacted about a consultation, yes or no. If you say no, you're never really going to hear from us again. We don't really do anything, in terms of the information. You say yes, we'll reach out and try to set up a time with you. But just know, if you say no, you're never going to hear from us. It's not how we operate. It's not what we do. We don't want to be trying to, hit anybody or do anything unless you ask us to. And that brings me to the end. Any other questions out there? Any questions for anybody?
Thank you so much. This was fantastic. It's Laura. I just wanted to share one free resource that's available to Massachusetts residents. It's the SHINE program. I don't know if you've heard of it or tell your other clients about it, but SHINE is an acronym. It stands for Serving the Health Insurance Needs for Everyone. And it's a free, unbiased health insurance counseling program for Massachusetts residents that currently have Medicare, their caregivers, or those approaching Medicare. Right. And so it's a great program, and I'll put the link in the chat, but it's just, so if people are having questions, you want to follow up with Tom, that's great. You can follow up this other free resource too. They can help you over the phone.
That's great, Laura. Thank you for that. Yeah, because that's like we said, it's not something that Craig and I do. When you get into that with Massachusetts, Medicare is a different, animal in terms of going through it. So having organizations like SHINE and other types of professionals. Absolutely a benefit, and you should definitely take advantage of it. Anytime you get questions on stuff like that, better to seek it out and ask the question versus getting stuck and not realizing, oh, wait a minute, I didn't, this didn't work for me type of thing. Craig, any other questions out there?
I'm not seeing any in the chat box.
Okay. So just know that if it's sometime later today, tomorrow, whatever, you say, oh, wait, I wish I had asked this. Always understand, you feel free to reach out to us, but probably tomorrow you'll get the link, the evaluation form from us. We just ask you to take the time. It's not very long. It's not very involved, a couple of minutes, and send it back to us. We appreciate the feedback we get from everybody. And certainly if you know any other organization that might benefit from hearing from Craig and I, include that in there, because we're always happy to try to do this as many people as we can. That's what we do. So on that, I'm going to stop my share and say, I appreciate all of you today. Thank you very much. And like I said, we will send the recording out to Laura so she can share that with everybody. Take care.
Thank you so much, Tom and Craig. This was fantastic. We really appreciate your time.
Thank you, Laura. No. We agree. This is one we love to do. We have a lot of fun with this one. And obviously you can see that we enjoy this one a lot. There's a lot to be involved with it though. That's the whole point. Have a great rest of the day.
Thank you.